Good afternoon, everyone, and welcome to the CanSim webinar. These have been a webinar series that have been well attended, and so today we're very excited to present a very special webinar. And if I could introduce our guest speaker today, it's my privilege to introduce Dr. Kris Dreifuerst. She is an associate professor at Marquette University College of Nursing in Milwaukee, Wisconsin. Her research is at the forefront of disciplinary efforts to develop, use, and test innovative teaching methods to improve students' clinical research, and also investigate how educators can best be prepared to use evidence-based methods to enhance clinical teaching. Her work has been recognized for leading initiatives to transform nursing education, and she has influenced pedagogical changes in educational practices locally, national, and internationally. Our speaker today developed the Debriefing for Meaningful Learning, or DML as it's affectionately known, which was used in the seminal national simulation study conducted by the National Council of State Boards of Nursing. The impact of her funded program of research is far-reaching. DML has been adopted by more than 500 schools of nursing throughout the world for use in simulation, traditional clinical settings, and across the curriculum in nursing and other healthcare disciplines. She is frequently consulted by the schools of nursing for her expertise in curriculum, instruction, and clinical teaching. She has authored numerous journal articles and book chapters on debriefing and best practices in teaching and learning. She is the recipient of prestigious national and international awards and honors from the National League of Nursing, Sigma Theta Tau International, the Midwest Nursing Research Society, and the International Nursing Association of Clinical Simulation and Learning, recognizing her expertise and contribution to the field. In addition, our speaker is the past president of INAXL. She is also the associate editor for the Journal of ClinSim in Nursing, and she holds editorial board positions on 3 esteemed journals. Today's speaker is a certified nurse educator, and she is inducted as a fellow in the Academy of Nurse Education and also as a fellow in the American Academy of Nursing. Please join me in warmly welcoming Dr. Kris Dreifuerst. Over to you, Kris.
So today, we are going to talk about why is debriefing so important and how do I use it to foster learning. So really what we're going to talk about though is what is evidence-based and theoretically derived debriefing and why does that matter so much? I have to tell you that that is one of the questions that I get asked the most often. And so I do want to spend a little bit of time talking about that with you. And then I also want to talk about how do we know that debriefing is important? How do we know? And then finally, I want us to end with fostering learning using debriefing with all different clinical and simulation modalities. If you're just joining, and could you just mute your microphone because I am getting a little bit of back feed. So debriefing is a central component of simulation-based learning. In fact, you would be hard-pressed to find an article or a teaching strategy. In fact, I think you'd be hard-pressed to find a simulation, either in Canada, in the United States, or pretty much worldwide, that did not include debriefing. It is considered a piece or a component of simulation-based learning. But debriefing did not start with simulation. In fact, debriefing precedes simulation learning by almost 2 centuries. And in fact, debriefing across the curriculum, which is really the buzz term right now, demonstrates that debriefing is a central component of all learning. But it's especially important for clinical and contextual learning. So what does that mean? It means that when we are in a practice profession like nursing, or really all of the healthcare professions, debriefing is a critical component. It's a critical piece. And honestly, we do it without even realizing that we're doing it. But when we do it intentionally, deliberately, and with methodological intention, then we actually foster our best learners' ability to take what we're talking about and apply it into their practice. That's essentially the definition of meaningful learning. But let's go back for a second. Let's talk about what is debriefing really. I can tell you that if you look up debriefing in the English thesaurus, you're going to see that debriefing is equated with words like questioning, an interview, an examination, an interrogation, or probing. However, if you translate the English word debriefing into other languages worldwide, the language or the lexicon changes a little bit, because we hear that the definition or the translation becomes words like dialogue, discernment, discovery. And I think probably adopting some of the English interpretation of debriefing, we also now see in our Asia Pacific cultures that when they equate or translate the word debriefing, they use words like unpacking, discovering, unpeeling. And those are words that we use also, because debriefing is a dialogue, it's an interaction. And in simulation-based learning, actually in all clinical learning, we use it as an intentional discussion or dialogue between a teacher and a learner, a debriefer and a participant. It's intentional because it's not a random conversation. It's not tell me anything that you're thinking about. It's not a conversation that has no direction, no intention. At least it shouldn't be. Good debriefing has a plan, a process, and an implementation. So I would be remiss if I didn't direct you all to the NAACL Standard of Best Practice Simulation for debriefing. And I am certain that most of you in CanSim know this standard, but I think it's always worth coming back to. And I want to remind you that the standards are a dynamic reflection of the literature of the time. So this standard of debriefing is actually a tiny bit outdated, and we're anxiously anticipating the next language, the next standard to come out that will reflect much more of the literature that has occurred since this one came out in 2016. I can tell you since 2016, there have been almost 7,000 journal articles that reference or refer to debriefing in the healthcare literature alone. So there's quite a bit of new information that's going to inform the standard. But currently, this is the standard that we use, and this is the standard that we follow. So in criterion 1, we say that the debriefing is facilitated by a person who's competent in the debriefing process. At the time that this was written, we really didn't understand what that competence meant. We're getting closer to that now. And this is applicable in virtual simulation and online debriefing also. So this isn't just meant for debriefing mannequin simulation or debriefing standardized patient simulation or debriefing screen-based simulation or debriefing VR and IR. This is really for all debriefing. We need a debriefer who's competent in the process. And debriefing supports confidentiality, trust, open communication, self-analysis, feedback, and reflection. And we'll talk more about this in just a few moments. We also know that debriefing needs to be facilitated by a person who has devoted enough time so that they can effectively debrief. Time and attention, really. And debriefing is based on a structured theoretical framework. Again, we're going to spend a little more time on this one in just a moment. Debriefing is congruent with the objectives and the expected outcomes. Again, so it's an intentional conversation. It's an intentional dialogue. It doesn't go down a rabbit hole. It doesn't get off course. It has a plan, it has a process, it has a methodology. So again, I told you that I get asked a lot about this idea of evidence-based and theoretically derived. I think that the reason that this is so important to me is probably because I am a nurse scientist and because I understand that research is based on testing theory, and all our evidence is based on theory. And so when we think about a debriefing method, or we think about debriefing being evidence-based and theoretically derived, there's really two concepts going on here, and they work in tandem with each other. So most of us who are educators understand that there are 5 main categories or areas of learning. We have 5 main theories of learning. And inside of these, we have different theorists who have different iterations, but really there are 5 that encompass our understanding of the theory of learning. We have the behavior. Now, behavior, you know, in simulation is important because in simulation, we do have a behavioral aspect. We do have muscle memory. We do have actions that we want the learner or participant to engage in. And so we have those theories. And then we have the theory of cognitism, or the cognitive theories of brain science. We have the theories of constructivism, the mental models. We have the theories around experientialism and learning experience. And then we have the social and contextual theories. And when you think about debriefing and you think about how these theories flow into one another, and they are a bit hierarchical, as you can see in this picture. When you think about debriefing, debriefing encompasses all of them when you have strong methods. So you have the social dialogue, you have intentional aspects of experiential learning, you have intentional aspects of constructivism, you have intentional aspects of cognitism, and you have intentional aspects of behavioral theory. So making sure that the intervention, the debriefing, is theoretically derived is only the first step. We then have to test the theory. And so that's why you see there are different methods of debriefing, and some of them have more science around them. And in that science, we are testing these pieces. We are testing the theory, just like we test theory in all aspects of nursing research. And from that testing, we derive the evidence. Now, in debriefing, we also create debriefing from evidence. So evidence contributes to debriefing both in how it's developed and in its outcome. So when we have strong debriefing methods, we have both of these aspects. And that's really the gold standard. That's really what we're looking for. And that's how we get from this casual conversation about a clinical event or situation into a very intentional dialogue that has a purpose, it has a structure, and it has an outcome. Almost all methods of debriefing have these 3 components. There are a lot of other components, but these are the 3 that we see consistently in healthcare debriefing. We have some aspect of recollection, recalling the events, some format, some methodology, some aspect of that. We have some aspect of reflection. And so how reflection is played out is done differently in different methods, but how it is queued up, how it is prompted, how it is utilized, how it is developed, and the intended outcomes from reflection vary considerably, because reflection is a really big theory and it has all these different components to it. But good debriefing, in addition to recollection, does have reflection and reflective pieces. And most of that goes back to Schoen's work around the reflective practitioner. Then there's also this feedback piece. Now, in feedback, really we're talking about what went right, what went wrong, and what would you do differently. That is the entire feedback sphere in debriefing. And some methods of debriefing spend a lot of time on this, and some methods spend less time. In fact, right now in this diagram, all of these spheres or bubbles are about the same size, but in reality, each debriefing method, these bubbles are bigger or smaller depending on the methodological framework. So in some methods of debriefing, feedback is the debriefing. It is the biggest piece. There is some recalling, because you can't give feedback without recalling, but feedback becomes the central construct, and reflection is very small. In other methods, reflection is very big and feedback is very small. And each of these are methodologically sound. They just use different theory. So when you're looking at debriefing and when you're thinking about how am I going to use debriefing to foster meaningful learning, you really need to think about your learners. You need to think about what is it that I'm trying to get them to do? What is it that I want as the outcome? What do I want to understand from the experience I just witnessed them doing? What do I want them to take away from it? And from that, the decisions are made around recalling, reflecting, and providing feedback. If we go back to this slide for a minute, I just want to kind of point out to you a couple of things. So feedback is really around behavioralism. It's around the behaviors that were done. It really doesn't get into cognitivism, constructionism, or experientialism. It's really about, do this next time. This is the feedback I'm giving you. It's not about why this happened or how you can do things differently. It's just the behavior piece. Reflection is really a combination of cognitive and constructivism. And so that's that piece of the theory. And then recalling is really the experientialism, and the entire debriefing conversation then is the social and contextual piece. So why do we spend so much time on this? Because it's important to understand that what debriefing is really is a teaching learning method, or if you like the word strategy, it's a strategy. It really is a way of doing good clinical teaching and fostering good clinical learning. But it needs to be done with some intention. So let's think about this for a moment. Learning really involves all of these pieces. Learning involves recalling, because we often learn experientially from what the outcome has been from things we have tried in the past. Learning also involves recognition. Having recognition that something had a positive outcome or had a negative outcome, that whatever we experienced, that there was a stimulus and a response, that the response may have been what we intended, or it may have been an unintended response. And so we can recognize that things were done right, or we can recognize that things were not done right. We can recognize that we hoped that by giving the patient Lasix, that they would have diuresis. But if they don't, we need to recognize what else was going on. And part of recognition is also reflection. And those are very nuanced, but they're very, very different. In reflection, we add meaning and context. In recognition, we're really just sorting out what happened. In order to reflect and have meaning, we need to interpret. And so interpretation is also a component of learning and a component of debriefing. And then there's that correction. Remember, we talked about that feedback piece. There's perception. This is what I thought. This is what I thought I saw. This is what I assumed. This is what I perceive. And then ultimately there's comprehension. But comprehension isn't enough. You see, learning needs to lead to action. And that's what we're trying to do when we use debriefing contextually with our learners after they've had the simulation or clinical experience. Ultimately, if you look at the right side of the screen, it all comes down to this. We're trying to figure out with the learner what occurred. And in those critical decision-making points, did we have right thinking and right action? Yay, that's what we're going for. Or did we have wrong thinking and wrong action? So was the thinking wrong, thus the action was wrong? Now the green and red boxes, those are the easy boxes. Where we get stuck is in the gray boxes because, you know, these are learners and we are pouring a whole lot of stuff into their heads. And they're trying to put together all of this physiology, pathophysiology, anatomy, nursing care, understanding the labs, understanding the meds, understanding the assessment, putting it all together so that they make a decision. And sometimes it's just too much. And so sometimes we have right thinking, wrong action, or we have wrong thinking, right action. Now, why this is so important to understand for debriefing is that it's not enough for you as the debriefer or the clinical teacher to watch the learners or the participants doing something. And when it looks like they've done the right thing, you cannot assume that they did the right thing for the right reason. The only way you know that is to probe and to query and to debrief, to understand what was the thinking behind the action. Because honestly, we do a lot of things and they are the right action, but they're for the wrong reason. Likewise, sometimes we see something and it's not what we want the student to do. We would consider it the wrong action. But only through querying them and understanding the thinking in their head do we understand that they had the right thinking. They just did the wrong thing. And so we need to match up and correct the action so that the thinking and the action go together. This is, again, probably the most important reason that we debrief is these 4 boxes right here. We also debrief because we want to facilitate, demonstrate, and model deliberate thinking practice. You know, nursing is really moving from being a task-oriented profession, if you will, to being a thinking-oriented profession. You know, in nursing, 30, 40, 50, 60, 70 years ago, the nurse was the task doer. The orders came, the nurse did them. We taught tasks. Tasks were the most important piece about our role and what we did in the healthcare system. But we're now a knowledge worker. We are now interpreting data, using data, understanding data, making decisions, autonomous decisions every single day. And in order to do that, we not only have to do muscle memory for the tasks, but we need to do muscle memory for the thinking. And debriefing is a way to do deliberate thinking practice. But in order for that to happen, we have to remember then that the methodology that we use to debrief, the way we debrief, the system, the method we use needs to be consistent. because you know when you're learning a new task, you need repetition. And the more times you repeat it, the easier it comes. The same is true with debriefing. So it's very difficult for learners or students if they have clinical and they debrief one way, and then they have sim and they debrief another way, and then the next semester or term comes and then they have new instructors and they debrief differently again. And so what happens is we lose the opportunity. It's a missed learning opportunity when we forget about the importance of deliberate thinking practice. Part of the methods that are out there is the utilization of pattern recognition. So when you see folks use a consistent method of debriefing, you're teaching the learners pattern recognition. So you're teaching them to think about how you question them, how they question themselves then, how you talk about things with them with queries and prompts is how they learn to query and prompt themselves. Basically, debriefing really is training the brain to challenge taken for granted assumptions. Is this right? I'm standing at the med cart. Is this right? Does this med make sense? Does this med make sense for this patient? Does this med make sense today for this patient, given all that I know? So it's less about rote activities, actions, and more about making sure that the thinking and the action are in tandem together. Debriefing as deliberate thinking practice is about teaching our learners to consistently synthesize, analyze, hypothesize. Synthesize, analyze, hypothesize. Put the data together, does it make sense? And ask the questions. And what we're starting to understand is that when we do this, and when we think about debriefing as deliberate thinking practice, and we do use consistency and pattern recognition, we're starting to understand that learners run that dialogue in their brain later in practice, pretty subconsciously, but yet they can pull it out if we probe hard enough. They can go through the checklist that they're going through, even though in the moment they're not aware of it. So again, this is about helping learners to deliver safe and consistent healthcare. There's one more piece of debriefing, and that is the idea of assimilating, accommodating, and anticipating. And all of the evidence-based and theoretically derived methods have some aspect of this in them. So when you assimilate, you're continuing on with something that makes sense. So if I have taken care of a patient with high blood pressure in the past, and now I see another patient with high blood pressure, when things are similar, when things are making, I can make a parallel to my first patient, I assimilate. I continue to do what I did before because that's what I need to do. But if the first patient I took care of got a medication, lisinopril, and the blood pressure went down, and then this new patient gets a medication, lisinopril, and the blood pressure goes up, then I need to accommodate. I need to change. I need to pivot. And through debriefing, we can help learners to understand that pivoting that occurs in nursing practice as a part of thinking like a nurse. But it's very hard when you're a novice, because when you're a novice, it should all be black and white. You give the med, you should get this result. You give the med, you should get this result. You make this action, you should get this outcome. And so talking through, dialoguing through, understanding the complexities, that it's not just stimulus response. It's not just A equals B when you're taking care of human beings, but understanding how we constantly accommodate is a huge component of debriefing. And then finally, there's the third aspect, which is the anticipation. So it's not enough to have this rich dialogue about healthcare. It's not enough to talk through what occurred and why it occurred and how it occurred and what you were thinking and what was the information you used to make the decision. And it's not enough to just talk about it. The intention is that the next time that the learner has a similar encounter or a parallel encounter, that they can use what occurred in debriefing to augment, to change, to hold up their practice, to underpin their practice. So we are working with anticipation in almost all debriefing methods. And so we talk about, how are you going to use this next time? We talk about, so if you encountered this instead of this, what would it mean to you? What information would you need? How would you go about making the decision? What actions would you take? All of those aspects come out as we help learners to anticipate. So I just want to talk a little bit about debriefing virtually and face-to-face, because this is a big thing right now. In the current global pandemic, we are all learning that we need to teach our clinical content differently and in different environments. And we're using a lot of virtual experiences. And we want them to be meaningful. We want them to have the learning impact that we depend on in our face-to-face encounters. And I think it's important to remember that as far as debriefing virtually versus face-to-face, in whatever modality, if you're doing screen-based simulation, if you're doing mannequin, if you're doing SP simulation, if you're doing simulation with AR and VR, the principles, the structures, and the methods don't change. Let me say that again. The principles, the structures, and the methods don't change. The standard for debriefing, the NACSL standard, is the same for all of those modalities. The methods that we use are the same. The process that we use is the same. The questions that we use are the same. The role of the learner, the role of the debriefer, the role of the student, the role of the instructor, it doesn't change. The expectations don't change. We still want all of these things to occur: consistency, pattern recognition, challenging taken for granted assumptions, working on synthesizing, analyzing, hypothesizing, assimilating, accommodating, and anticipating. The roles don't change. Now, they may change a little bit in terms of, does the learner actually interface with the virtual simulation? Do they observe? How do they participate? How much of it are they actually immersed in it, in the experience? How much of it do they have to co-create the story in their head? But ultimately, the intended outcomes don't change. We still want to have this deliberate conversation. We still want to have this dialogue that has discernment and discovery. We still want to unpack and unpeel the thinking that underpin the actions. We still want to work through with students right thinking, right action, wrong thinking, wrong action, etc. The modality and the interface do change. And sometimes we get stuck there. You know, I've had so many conversations, but how can they experience putting in the IV when we're talking about a screen-based simulation? But how can they experience the emotion of the conversation with someone who is dying if the patient is an avatar? But how can they experience, and I'm gonna tell you, we gotta let that go. We gotta let that go, because if we do a good job of debriefing, it doesn't matter. It really doesn't matter. If you can use good technology to have an intimate conversation whether it be in small groups or large groups, whether it be like this, as we're doing today, or whether it be just you one-on-one with the learner. How you use the technology is what makes you the teacher, what makes you the debriefer. How the student experiences the modality is up to you. And so strong debriefing has never been more important as it is when we're talking about virtual simulation and virtual clinical experiences. So, what are we really talking about? What are these best practices of teaching and learning? Because honestly, that's all that debriefing is. Debriefing is using the best of what we know about teaching and learning. So, good debriefers know that their role is to be the guide by the side, not the sage on the stage. A good debriefer puts the learner or the participant at the center of the conversation, and they stay on the periphery. Their role is to guide the conversation, not to control it and not to usurp it. This means that in good debriefing, we don't lecture, even when it's clear that the learners or the participants have no idea what you want them to know. So what do we do then? We help them to co-create the knowledge. Start with what they do know and work into what they apparently don't know. Help them to figure out, what are you going to do in practice when you don't know? Where are you going to look it up? How are you going to look it up? How are you going to figure out when you know something and when you don't know? But lecturing has no place in good debriefing. There's no shaming in good debriefing. My gosh, when you think about the amount of content that we are throwing into these brains to become a practicing nurse today, it's daunting. It is almost takes your breath away, doesn't it? I mean, what we want people to do so that they can be strong professional nurses is we want them to have all this knowledge and then also be able to understand it all and be able to apply it all in a myriad of conditions that you can't predict, that you can't control, and that just keep coming at you. So when learners are confused, when there is wrong thinking or wrong actions, the important thing is to keep the shame and the blame out of the conversation and go back to what were the assumptions? What were the incorrect ideas? Where did it go off the rails? Focus on it as a process, not on the person. Because good debriefing conversations should end with everyone feeling really engaged and really comfortable and acknowledged for their contribution to the clinical situation. Good debriefers use questions, not answers. So, and not prepared ones. So what this means is that each group that you debrief, even if you're debriefing the same scenario over and over all day long, believe me, I've done that endless times. Every debriefing session should be unique. It should be about what this group experienced, not what you hoped would happen, not what you wanted to happen, and not what the last group did. This is about what this group did and understanding the thinking and the actions of this group of learners. That's why prepared questions don't work, because you need to be asking things that are relevant to what's going on with this group. Now, What about objectives? Of course you want to debrief to the objectives, but the objectives have to be relevant to whatever the experience was also. So if the intended objective is that the student identifies something and gives a medication and they don't get there, it's not helpful to focus your debriefing on the medication and the fact that they didn't get there. You have to go way back and figure out where they got sidetracked and focus on that, because that's what's relevant to that group of learners. In good debriefing, you engage everyone with intention, and this is the most critical piece. And if you leave with nothing else today, please leave with this pearl. You need to query on what went right as often as what went wrong. Let me say that again. You need to talk with your learners as much about what you saw them do right as what you think they did wrong. Because remember that 4 square box. Remember that you can have right action for the wrong reason, and you won't know it unless you talk about it. And if you don't talk about it, the student leaves thinking that the action and the thinking were correct, and takes that forward to the next time that they care for somebody. So as we think about wrapping up, I really want to go back to what is debriefing really. Debriefing is an intentional conversation. It is a deliberate thinking conversation with some regular, consistent pieces so that you can teach thinking like a nurse or like whatever healthcare professional you're working with. It needs to be contextual. It needs to be relevant. It needs to be safe and done in a safe space in a safe way. Debriefing is a conversation that is focused on the events that occurred with the intention of applying this information to the next patient or the next care situation. Debriefing is an art. It's also a science. Debriefing is something that you have good days and bad days with. Some days you go in and you think, I am gonna do this, and you just get nothing. You can't spark the conversation, you can't get engagement, you can't get the group going, it just goes flat. But you know what? Then you get up the next day and you do it again. And I guarantee you, we all have off days. It's not something that you're always good at. But when you get comfortable with it, the results are astounding. You will see dramatic change in the learning outcomes of your students and your participants. And you will see that you, by teaching them deliberate thinking practice, deliberately how to think like a nurse, that you will impact their practice long after they leave the academic setting. I'm going to stop and see if there are questions. I think we're going to put questions in the chat. We won't probably get to all of them, but we can certainly spend a little bit of time on some of them. Here's my email address. I very much appreciate the opportunity to speak with all of you today. If I can be of any help to you as you continue on your debriefing journey, please don't hesitate to reach out to me.
I'd like to thank you very much, Kris. This was a fantastic presentation. I'm Jane Tyerman, co-president of CanSim. So we'd really like to thank you for this opportunity to really talk about debriefing and how we're going to be debriefing, especially in the current pandemic with the virtual. So that's one of the things that I wanted to ask you about. I agree with you not having those pre-populated questions because it really is contextually bound on the experiences of that individual group. But when you're looking at virtual debriefing, because there are different platforms out there, the CanSim has their method of their virtual simulation games. There's other products out there where it's very, you select an answer. If you're going to debrief those, which I feel is even more important for that debriefing piece, what are your thoughts on, creating those questions based on the learning outcomes to help to guide decision?
Sure. I mean, so it's a tough question. When we look at I'm going to call it the dashboard, when we look at the decisions that groups have made, so we see, there are 4 choices, or there are 2 choices, and 3 students choose A and 3 students choose B. You really have to understand all of those. And so you have to make a decision. Is this choice, is this decision-making moment so important that we're going to spend time talking about it? Because not everything in the virtual sim rises to that level. But when you do see that choice, then you really have to talk through, okay, so, and I would even do something like this. And this is what we are doing is, okay, so I see that, half of you chose A and half of you chose B. So we're going to talk about both ideas. So for those of you who chose A, and I know from the dashboard, but I'm going to now engage them and talk through. So let's talk about what led you to choose A. And in many cases, they each have a different answer. It's not the same reason that they all chose A. And they all know that A wasn't the right answer. So they're all feeling a little, anyway. But what I want them to understand is just knowing that A isn't the right answer isn't enough, because that's just feedback. And so, yeah, great, next time you're going to choose B. But if you don't understand why you choose B, and you don't understand why you chose A already, then that's a missed opportunity, and that's going to lead to a mistake in the future. So it's really imposing the art of debriefing onto this. Now, it's much easier to debrief when you have 2 or 3 or 4 students doing a mannequin-based sim, and maybe you have some observers, and it was one scenario in one group. It's much more difficult to work with the nuances of, people chose different things. And so you almost have this 4-way conversation. If there are 4 choices, you have to understand each of them. And the whole group has to understand how those choices occurred and how they were made. I'm going to tell you that as we've been, since March, doing this kind of debriefing, what we have had are some of the richest conversations we've ever had with these groups in debriefing, because what's coming out is all kinds of taken for granted assumptions. Like, students will say, well, I thought this was always true. And other students will say, well, I thought that on the exam, this was the right answer, so I chose it in this clinical situation. Not really putting together the details, really just taking the knowledge nuggets. And so we've had to really unpack. So knowledge isn't enough. You have to have context, and then it has to fit. So that's what we've been doing.
That sounds great, because it's more important to, so we oftentimes assume that we got the correct answer, that they must have known why it's the correct answer. And oftentimes I don't really know. So when we started our simulations and did our studies for virtual, the students actually had to ask us, can you please tell us why that answer was correct? So we don't necessarily know. And I think that's where the rich part of the debriefing comes out, to draw out that learning. Does anyone, I have lots of questions, but does anyone else have a question?
A couple of questions here from the chat feature. First of all, again, great presentation, Dr. Dreifuerst. It really was very powerful and has given us a lot to think about in a very short period of time. 2 questions. First is going to be an easy one. Where do you get professional development for DML? How do you become more proficient in DML?
Right. So I'm going to tell you that there are different ways to do it. There are articles, there are seminars, there's one-on-one. And one of the ways that a lot of people are getting proficient at it right now is that there are about 9 studies going on, and people are participating, and they're recruiting participants. And so you get training as a part of that. If you want more information, I'm going to refer you to my website. We now have a website. It's www.dmldebriefing, no space, no underline, no nothing. It's all like one word, all lowercase, dmldebriefing.com. Now, I'm going to tell you also that we are in the middle of uploading a whole bunch of stuff, and we've just moved platforms. So if you're going to jump onto that website, why don't you wait a week? Just put it on your tickler for next week, because this week it's not going to be very helpful. Not going to be very, it's really under construction again. But we are starting to push out more video. We're starting to push out more training options. We're starting to push out more information because so many people are asking.
That's fantastic. Thank you so much for that. Second question is, how do you create psychological safety in debriefing?
Right. So this really could be a whole webinar by itself, and I would urge you to perhaps think about doing that. So there are two schools of thought. Actually, there's probably more than two, but there are two predominant schools of thought on this. One school of thought is that you should spend a lot of time debriefing feelings before you get into actions. That is not my position. I am in the other school of thought, which says that if you do a good job of debriefing decisions and actions, that the emotions will take care of themselves. As long as you create the safe container, you ensure each time that you debrief that you have this private place where you can have a conversation that is safe, that is respectful, that is not shaming or blaming, and that you have the understanding that everything that occurs in debriefing stays in debriefing. Here's my example. In the first group, the group that I don't belong to, they would say, there would be an incident, and the debriefer would say, well, how do you feel about this? And a learner might say, well, you know, this reminds me of, or I was so nervous, my hands were sweating. And the debriefer might say, tell me more. And the student might say, well, you know, my hands have sweat like this whenever I'm nervous ever since I was a little girl on the farm. And then the debriefer would say, well, tell us more about that. And the little girl would say, or the learner would say, well, when I was a little girl, you know, I would go to my grandparents' farm and there were all these animals and they would scare me a lot and my hands would shake and then they'd sweat. And now you've gone down this rabbit hole that you can't dig yourself out of. You are so far away from the context of the purpose that you're there with these very precious little few moments that you have to debrief that you can't even go there. And if you oftentimes go there, you get yourself into this mental health situation that you cannot dig yourself out of. So that's fine if you're comfortable doing that. The people who live in my school of thought, we really believe that the purpose of debriefing is to foster learning, and emotion deters learning. So we need to pull away from that. And so, you know, we use different strategies to park the emotion so that we can focus our conversation on the decisions and the actions. And trust me, you know, this parking the emotions comes out of great, well-studied psychological strategies that then allow you to, if the emotion is important, it will come out, but it'll come out constructively within the context of the decision and the actions. So again, it's not that the other school of thought is wrong. It's a different school of thought. So different methods do different things with this emotional piece.
I think that's really important. Do you have any suggestions for, there's multiple different types of debriefing for virtual, like the asynchronous, synchronous, in-person. Is there one that you recommend, and what was it based on? Is it based on the scenario, the level of the learner?
Yep. I still recommend that you have dialogue. I recommend that the dialogue be virtual if it needs to be in person if it can be as quickly after this, after the experience has occurred as possible, certainly within a 4-hour window or period. I'm not a big fan of asynchronous debriefing. I'm not a big fan of discussion boards for debriefing. I think they're fine for a discussion, but you can't have a dialogue. You can't have the rich, you can't have the deliberate thinking practice. You can't have the structure. You can't. So then the purpose of the debriefing changes when you take it out of conversation. So, and that's fine if that's your intention, but you should do so not for convenience, but for intention of learning.
Perfect. I agree. Do we have anyone else that wants to unmute and ask a question? I think we have this amazing opportunity with Dr. Dreifuerst. I think it was really, really well explained. And do you offer any other courses or in more depth about DML?
Sure. This obviously was not DML training at all. DML training can occur different ways. Myself or members of my team, we come to schools and we train schools, we train big groups, so groups of schools. We do webinars like this. We're doing virtual training now in the era of COVID. So there's lots of possibilities. Again, if you're interested in training, you can reach out to me through my email that I gave you, or next week through the website.
Perfect. We'll also put that information on the CanSim website.
Sure.
So that anyone who has any questions or concerns, we'll put that in there for them to contact you. I think that this would be a great opportunity. I've had the opportunity to debrief in various different methods, and I really enjoy this method. I think it brings out that rich content where the learning really happens in that debriefing piece. And just one quick final question. I'm back onto the virtual again, because this is a big topic now. What is your recommendations for the amount of time for debriefing compared to a virtual debriefing and a virtual simulation?
Right. So let me first make a plug, and then I'll answer your question. So my team and I have an article coming out in Nurse Educator later this summer about how to use DML in virtual platform with virtual simulation. So if you want really specific information, we really go through the process and the procedure in that article. So I don't think time has been settled in any modality. I don't think we understand time well enough, how much time it takes, how much time it should take, I think that is an area that needs to be studied so much more. What we do know is that the more time we spend, the more learning occurs. And so whenever we can afford the time, we should. We also know that the bulk of the learning in simulation-based learning occurs in the debrief versus in the simulation. At least we have 3 decently done studies that demonstrate that relationship. So I don't think we know. I can tell you that what I'm seeing is that for a canned product, a screen-based canned product like a vSim or like some of the things from GNSH or some of the things even from CanSim, what I'm seeing happen, at least in the United States, is that it takes students about 20, 30-ish, 45 sometimes minutes to participate in that experience. And the debriefing is typically 2 hours. But that's because you've got a group and you have to go through option A, option B, option C with all of the different people for these critical pieces. So in actuality, these debriefings are taking longer because the complexity is more.
Right. Excellent. Thank you so much.
I'm going to jump in here because it is after 1 o'clock, and
Yes.
I know that we have several people jumping off the line. I know this discussion could go on all afternoon. It's been so interesting and so informative. Dr. Dreifuerst, thank you so much on behalf of CanSim and Canadians. We just want to thank you for joining us today, and we appreciate this introduction to DML, and I know we're going to take it back to our schools and see how we can implement it, and also to help us to not be as fearful about debriefing with virtual simulation. So all of this has been such a good discussion and really has helped us. We'll look forward to your article coming out in August. So thank you so much. Your time has been so appreciated. And thank you to all of our participants today for joining today's webinar.